there are some really fundamental differences between swine influenza and avian influenza. So influenza in a mammalian host is quite different. In pigs, it causes an acute respiratory disease, and of course the age impact of the infection will be quite different. So post-weaning is when you typically see most of your influenza problems, and gradually with age, the impact and severity of those signs will reduce. However, if you do surveys in your adult pig population, and you look in your sows, for instance, you will see quite a high seroprevalence. So these animals do get infected, but perhaps only mildly, and the impact of that is much less. So generally, when influenza is present in an area, and if you've got any sort of sustainable pig population, you will have influenza. An interesting story, a few years ago, the Australians claimed strongly that they had no influenza in their pigs, which was a bit of a puzzle, because I said, well, do your pigs never have contact with people? Because when pigs have contact with people, they acquire human influenza, and those viruses are then maintained endemically in pigs. So the reality is it would be impossible, I would suggest, anywhere in the world to find pig populations that have not got some exposure or have got some sort of influenza being maintained. The economic impact in commercial production can be quite significant. This is through the morbidity effect, so it takes longer for a commercial producer to bring his pigs to market weight, and that can be something of the order of around $10 per pig. Some estimates we made in the UK, that would be £65 million per annum in lost production. So economically quite damaging. Then, of course, there's welfare issues when pigs become infected with these viruses. And of course, more recently, there's a greater awareness of this risk for zoonoses. And of course, this was brought very much into focus in 2009 when a virus exited the pig population, entered humans, and caused the pandemic. But we should also remember, and this has been mentioned through discussion already at this meeting, that actually the frequency of reverse zoonoses is much greater than zoonoses. And when those reverse zoonoses events occur, they quite often will lead to a virus becoming established. So it was like we heard this morning for rabies, spillover and establishment is a different issue. But many of these reverse zoonotic events actually lead to new stable viruses maintaining by transmitting through pigs. And the etiology is quite complicated. There are now multiple variants of strains, and it depends on which part of the world you are as to which strains you have. So you've seen this before, and we focus on the H and the M because they're the numbers that give the classification system for our flus. And you've also seen this slide, but here the important thing to note is these are viruses that are established, so they're capable of transmitting within pigs. And we've got H1 and we've got H3. Okay, so these really are the only two hemagglutinin serotypes that can be maintained independently in pigs. And likewise, neuraminidase, we only really have N1 and N2 so that can circulate. So this means that the number of serotypes in pigs is much smaller than we see in avian. So here we have these three combinations, and in this region, in the Latin America, there is evidence that all three of these serotypes are circulating. From time to time, when we do surveillance, particularly through investigation of clinical cases, and we look to isolate virus and detect virus, we will find occasionally other strains spilling over, but all of these almost exclusively fail to maintain in pigs independently for any significant period of time. Now, pigs have been a subject of interest for many years, even before 2009, because it was noted that they were susceptible to infection with avian flus. And this is because the avian viruses are able to bind the respiratory tract of the pig, and they're also able to be infected by human influenza. So they're a sandwich in the middle, if you like, between birds and people. And they also contain, human viruses are also able to replicate in the upper respiratory tract of pigs. Now that is important because transmission is through contact droplet transmission. So if the virus cannot replicate in the upper respiratory tract, it is not going to efficiently transmit. So we know that in principle, the pig could be susceptible to quite a wide range of viruses. And of course, this concept that the pig is a mixing vessel has driven actually a lot of studies. It's not just purely from a veterinary health perspective, because although that's important, it's better understanding of, is there a risk with influenza circulating in pigs? So this idea that avian viruses can enter pigs, human viruses can enter pigs, and in fact they can mix through genetic reassortment and produce a third virus which can infect humans. Now, I think those of us who were working with swine flu for many years started to lose belief in this theory until 2009. And what happened in 2009 was we had an H1N1 virus pass from pigs into people, and it caused the pandemic. Now, if we look historically, that wasn't an unusual event. The 1918 pandemic virus was H1N1, and that actually went from people into pigs, not the other way around, which was originally thought. Similarly, in 1968, the human H3N2 virus entered pigs and has spread around the world, and those viruses are still maintained in pigs right across the world. Now, I only put this in to show the complexity. These are North American viruses, and these colours represent different genes in swine viruses in North America. And this is the pandemic virus that appeared in 2009. And it was a mixture of many co-circulating viruses in pigs in North America, which uniquely acquired some viral genes through reassortment with a European virus from pigs. Why was that unusual? Because we always see quite strict segregation. There's very little movement of pigs between the Americas and Europe. There's a little bit, but not a lot. And so we see quite distinct fingerprints in our strains in Europe and America. So this was a very unusual event because we had a virus here that had genes from both European swine viruses and North American. Okay, pathogenesis and identification of the disease. So clinical signs can be very variable, and we've already heard this morning that there are a number of other viruses that could be confused clinically, which obviously means that where there is a suspicion, it needs to be followed up with sampling and laboratory diagnosis. So PRRS, which Chris is going to talk to us about, can be confused with influenza. David's already mentioned swine fever. PDNS, certainly there is a spectrum of clinical presentation. But normally with swine flu, you can see all age groups, but as I mentioned, post-weaning is where you would see the most marked clinical signs. You certainly will have a fever, there will be anorexia. The level of sneezing and coughing will be quite variable. You can get pigs that actually do not present with any clear respiratory problem at all, and yet when you sample those pigs, you will find a lot of virus in the respiratory tract. So it's not an absolute. The degree and severity of this will often depend on the presence of secondary pathogens. So secondary bacteria will often result in a much more severe cough. As a single agent infection, influenza can often be very mild in pigs, and you won't even know it's there. High morbidity, as I've mentioned, is often a characteristic, but mortality really is very low. So if you've presented with a problem where there's a high mortality, unless there's a very severe exacerbating problem, it's unlikely to be flu alone. And the mortality, of course, would be more likely restricted to younger animals. Now, this is a feature that's not always well recognised, reduced reproductive performance. So when sows are infected at a critical stage in their cycle, it may have an impact on fertility and reproductive performance. Whether that is a direct causal effect of the virus or whether it's an incidental effect because the sow obviously has a fever, and there's still an uncertainty, but of course these effects can actually cause some confusion with some milder strains of PRRS. So it shouldn't be excluded just because there's reproductive failure, that it couldn't potentially be influenza. But of course, normally, the pigs can recover very rapidly. So it's not necessarily progressive unless you've got a secondary problem. Now, if we look at the pathogenesis, it follows a typical curve here. So probably incubation period is about 24 to 48 hours after contact. And you will gradually get an increase in virus being shed through the nasal mucosa. And of course, you will get increased mucosal secretion. And then, of course, that is recovered. Shedding, it doesn't normally extend beyond 7 days. And of course, consistent with that, you will start to see the induction of specific antibodies to the virus, which come up around about 7 days. This is probably too early to be thinking about laboratory diagnostics if you're using serology. Much better to be looking at more 10 to 14 days post-infection if you're doing serology. And the clinical signs are usually quite transient. They're only a few days. Now, of course, this is a respiratory virus. The tropism is almost entirely restricted to the respiratory tract, so it's quite different from flus in other hosts. And you can see this consolidation, or this plum lesion. This is a heavily consolidated lung. I think, as Yvonne mentioned the other day, when sampling, yes, we want lesion material, but sometimes there is still no longer infectious material in those lesions, depending on how long they've been present. So an area that would include apparently better quality unaffected lung and lesion would be ideal for diagnosis, and only need about 1 centimetre cubed. And that should be ideally transported to the laboratory chilled. It doesn't actually need to be in transport medium. In fact, sometimes with influenza, particularly if you're taking nasal swabs from pigs, it is detrimental to put them in a VTM that is not stable at the right pH, because that will result in virus killing. So sometimes it's better to dry them, air dry them, and send them rapidly to the laboratory chilled. Okay, so the virus is maintained very easily in pigs. So I've already mentioned contact transmission. So in commercial pigs, the virus spreads very rapidly within a unit in a matter of days, even where there are pens segregating. And of course, the way we rear pigs commercially is very conducive to the spread of virus. So it will be a relatively short event. Now, of course, maintenance and persistence, a true carrier state has never been proven for influenza in pigs. What is more likely happening is that the introduction of new, young, susceptible pigs, so if this is a breeding unit, you have a continuous supply. The only way you can really break these chains of infection, if they're a persistent problem, is an all-in, all-out system. So you rear the pigs, you depopulate the farm, you cleanse the farm, and then you at a later point you reintroduce new stock. Because young pigs, there's a continual supply, they're naive, they don't have immunity if they're non-vaccinated, and the virus will be nicely maintained. Geographically, if we look at the near region here, Latin America, I should say until 2009 there was a lot of uncertainty about what influenza was circulating in pigs in Central and South America. Simply because there was no real driver to do that work. But post-2009, there was a lot of questions asked what surveillance was going on in pigs in South and Central America, because there was high uncertainty, had the pandemic virus been in pigs for some time before it transmitted to humans. And that really stimulated a greater international effort to look for flu. And as Keith mentioned yesterday, there's a very proactive group within OFFLU that's actually trying to address this. And so this shows some of the preliminary data. And essentially, what each of these coloured blobs is a different genotype of virus, but essentially what we've got is pandemic H1N1. So where there are pig populations, that virus is being maintained in pigs independently of people. So reverse zoonosis has occurred around the world, because as people who are infected with that virus travelled around the world, they passed that virus to pigs. So it wasn't transmitted pig to pig around the world, it was people infecting pigs. And those viruses have been maintained now independently of humans. They're very well established. And of course, that caused a lot of sensitivity for the industry, because this idea that pandemic flu was in pigs resulted in a big reduction in the uptake of pork and pork products. It was very damaging for the industry. And there was a lot of sensitivity. Industry did not want to submit samples because they were concerned that they would be blocked for trade. Unfortunately, in some of the early cases, there was some quite disproportionate international action. Now, obviously, through OIE and others, I think we're in a situation now where those concerns have largely been alleviated, but there is still sensitivity when we talk about pandemic virus. In addition to that, there's the H3N2 virus here, down in studies in Argentina, and H1N2 viruses, which have been around in North America for some time. So these viruses show a very strong relationship to the strains in North America. And likewise in Brazil, it's not unusual to see slight differences in the levels of circulation. Here in this particular study, they found more evidence of more H3N2 than the other strains. Now, this is a complicated map, and I'm not going to go through it, you'll be pleased to know, but what I wanted to put this up for is each one of these circles is a different genotype of flu. So it may be H1N1, or H1N2, H3N2, but the internal genes are different. And this shows the diversity that's now appearing with influenza. We're gaining a better awareness because we're doing more sophisticated analysis. But there are some real changes in the amount of difference that we're seeing. And yes, there it is down in the Australia. So they do have flu as well in their pig population. This is going to get more and more complicated. It's probably the way this virus is spreading is not clear, because obviously we're not moving pigs, but all sorts of indirect methods for spread of virus that we've discussed for many other pathogens are relevant here. But what it does mean is it's getting increasingly complicated as a diagnostician to work out what viruses you've got in your pig population. This is a map showing the likely rate of change and the emergence of new strains in pigs, and the darker the colouring, the greater the risk. Now, it's no surprise perhaps that the darkest colour is in China. I think actually as we understand more about flu in pigs in this region, these colours may increase in intensity, because at the moment they're classified as countries with low pig populations. Well, I'm not sure that all of those countries have low pig populations, and we may expect to see more variants of the virus appearing through better surveillance. So, diagnosis, again, there's the OIE manual, which has a chapter on swine influenza, and that's updated every 4 years. Carcasses, ideally, from moribund or sacrificed animals, because you can then remove the lungs, and they are the single best source for virus, no question. If there are no more, and of course it will depend on the age group affected, quite often in fattening pigs you won't have necessarily any mortality, then you need to swab sick animals, and you really need to take probably between 6 and 10 swabs per group, because it isn't impossible that you have animals at different stages of infection. Clotted blood, if you want to do serology, and increasingly there is opportunities being taken, particularly where you want to gain knowledge about what's circulating in your pig population, to make use of slaughterhouse surveys. So blood's taken at slaughter to understand more about country or regional status of being used. Okay, prevention and control. Well, obviously this is an endemic virus, so prevention, obviously, there's a lot of practice that the industry, we know it's an endemic infection, but obviously good husbandry practice to break the chain of infection, to deal promptly. If new pigs are introduced into a farm, for instance, from another source, then it's a good idea that they're quarantined somewhere away from the rest of the pigs, just to make sure that they're not actively infected before they're introduced to the rest of the herd. Carrying out surveillance if necessary to understand whether there's baseline immunity in your herd, and obviously thinking about if you are genuinely free, and I wouldn't pretend to really have a good guess as to whether any of your populations are free or not, although I suspect they might be infected, then obviously if you're importing, you need to think about the risk of importation. And then control, well, obviously it depends on the structure of your industry and how it produces, but in these pyramid systems, I mean, David showed a very nice diagram earlier for classical swine fever. Equally, that would apply to influenza. in terms of understanding the risk, these viruses will move very easily within a single enterprise if there is not appropriate biosecurity being applied. Now, there has been a massive increase in vaccination since the pandemic in 2009. And across the globe, there are now vaccines being used. There are no single vaccines because they need to be tailored to the region they're being used. And very often, vaccine manufacturers are very weak at supplying adequate data to show their efficacy. So I think if vaccination is a desired tool, there needs to be a very proper and clear discussion about which strains are being included in that vaccine and which ones are necessary. I think eradication, because they're endemic, is not really obviously an option. But of course, reducing the infection load through vaccination is one way producers are trying to deal with this concept that the pig is producing a pandemic virus. So if they can reduce the infection threshold in pigs, then obviously they reduce the risk of transmission to humans. And when those events occur, they can be very damaging for the industry.